Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. A little bit of news before we get started. I'll start with the most passive. A small snowstorm is headed towards Rhode Island tomorrow, 2 to 4 inches according to the National Weather Service, on top of maybe 5 inches we got yesterday, 5, 6 inches here in Providence. So stay tuned for more on that. We'll stay on top of the storm. And news over the weekend is that the long, spectacular career of Bill Reynolds at the Providence Journal is concluded. He was, just about everyone's favorite sports writer. And as much as a great columnist he was for the Providence Journal, probably a better author of books. The book Fall River Dreams, which is as relevant today as it was when he produced it 25 years ago, is about as good a read as there is relative to any type of reading. You don't have to be a sports fan to read that incredible journey that he spent about a year with Chris Herron in Fall River. Just a massive undertaking as an author and just a great read, award-winning book. And he's produced other New York Times bestsellers. We've got an overview of his tremendous career and all the folks that he touched. Take a look at that as well. Let's go to Dr. Michael Fine. Dr. Fine, the former director of health. We've got new numbers from the weekend. We've got update on vaccinations, and we've got some disturbing news on the impact of, or the failed impact of the AstraZeneca vaccine on the South African variant. Let's go to the numbers here in Rhode Island. Dr. Fine, what do you see?
Good afternoon, Josh. Things look like they are drifting in the right direction. Hospitalizations are down quite remarkably. That's a good thing. The number of new cases is down, but our testing is significantly off. That's probably weekend and snow as much as anything, I hope. But testing is off all around the country, not just here. Deaths, unfortunately, continue. 14 in the last 24 hours, 24 over the weekend. That's going to be hard to see, and is going to keep being hard to see, I fear. I think that sometime in the next 10 days, the nation will cross 500,000 deaths from this disease.
Yeah, tough numbers. Let's talk about the good news. And is the good news as good a news as we hope it is? So number of cases across the country are down. Number of hospitalizations have now dipped under 100,000 nationally over the past few days. Number of hospitalizations in Rhode Island for the first time in months are now under 300. But as you mentioned, testing has decreased, and there's a big worry about these variants. They're in the country. They're getting measured across numerous states, especially the UK. There's concerns about it. And if you listen to a Dr. Fauci or any of the national players in the White House, there's a real concern about what the impact of these variants are going to be in the spread of the disease and the infectiousness and potentially the deadliness of the new variants.
Yeah, in a certain way, we're in a race against time. The sooner we can get the population vaccinated, the quicker we will stop the spread of these new variants. The new variants appear to be moving quickly around the world. We haven't seen their impact here yet, though, again, we are at the time of year where a year ago, the virus was spreading rapidly in New York, unseen, and didn't manifest itself until 3 weeks later. That's what I fear about the variants, that they're out there unseen. They're getting under our less testing and our over-dependence on antigen testing, which is sometimes Binax is one of the antigen tests, which aren't backed up, and so you don't have the opportunity to do DNA sequencing, so we may not see the variants when they appear. That's what I'm worried about, and that's the race against time. If we can get large portions of the population vaccinated sooner than we expect, then we may be able to beat these new variants, but we're just not moving fast enough around vaccination to get there.
Let's just talk quickly about the BinaX test. It's a product of Abbott. It is also called the quick test. It's the test that you take before you get on a plane now. It takes about 15 minutes to get a result. We have our producer take a BinaX test before he comes into the office. You can get them around Rhode Island at different locations. And they also have, not only are they not backed up, thus you can't do DNA sequencing, but also they have a high level of false negatives in comparison to the PCR testing, which takes much longer to get a result. So that test has some benefits in which it's quick, but also some complexities. On the vaccination front, CDC numbers, we just pulled it just a little bit ago. Rhode Island's received 292,300 doses to date and has administered about 117,000 of those in total, some first doses, some second doses, for 60%. So of the 117,000 doses we've received, we've actually only gotten 60,000 of them administered.
Yeah, again, the numbers are always a little troublesome. We want to get them, every dose into arms as quickly as possible. Sometimes it takes a couple of days because vaccine clinics aren't running every single day. So I was hoping to see bigger numbers over the weekend. Our weekend numbers just weren't where I wanted them to be. I think we did about 4,000 new people over the weekend. I would have loved to have seen 6,000 to 10,000. It's getting new people vaccinated that to me is where is where my hope is. The more new people we can get vaccinated, the better our protection is going to be. We get some additional protection from second doses, but the big protection is in the first doses.
Right, so, national report this weekend, Gillette Stadium was used, I think, all weekend, 4,000 people a day at Gillette Stadium, 4,000 people a day at Gillette Stadium. We can't get 4,000 done across the state. I think we've run out of excuses of this failed vaccination program. It just got up, so we're getting, I think, around 16,000 doses a week. There's 40,000. There's more than 75,000 doses that haven't been administered. That's weeks of supply. I mean, weeks of supply that just aren't being implemented here in Rhode Island.
Yes, 70,000 doses is basically enough to vaccinate everybody over 75. And that's what I think many of us would like to see at this point.
Dr. Fine, not only are they struggling, but there's not a lot of disclosure over there, and a lot of effort to block disclosure. GoLocal submitted Access to Public Record Act requests to the agency to get certain documents, public documents. They weren't complicated. It was a 6-week period of emails between the CDC and the health department between December 1st and January 15th. Not only did they slow that process, they've requested payment for $3,200, which we have paid, and now the ACLU is about to sue the Department of Health on a number of fronts for violations of the records request. When you administered the agency, was it so complex to respond to public records requests?
Well, the good news was that I didn't have to do that myself. The department has some good lawyers, and they guide the department in making those choices. It's a big department. When I was there, it was 450 people, with lots of people having interaction with CDC directly, so that may be part of the complication. Again, I can't speak to the current setup and the current flow of work.
The lack of transparency, I'll say it if you don't want to, is just amazing during the course of a pandemic, and especially when you're trying to build the public's support and trust into the agency as their information is going out, and people want to be able to trust their information. So blocking the transfer of public information seems like a bad strategy. Dr. Fine, let's go to this, maybe the most disturbing piece of data that we've received in a week or so, which is the AstraZeneca vaccine, which has been approved in the UK and is now being approved in the EU, was being utilized in South Africa as the lead vaccine against their COVID outbreak. And South African officials say it just doesn't work against this new strain that is now spreading around the world. This has got to be deeply concerning for public health experts in how to, if this becomes the dominant strain and begins to take over in Europe and in the United States, there aren't a lot of tools in the toolkit to be able to fight against this new strain.
Yeah, though, Josh, I see it somewhat differently. I mean, I think we're going to see new strains evolve and new vaccine combinations created. It's kind of a game of whack-a-mole, and as new strains come up, the vaccines are just going to change, and the frequency are going to change, and the need for boosters is going to change. We will create new strategies as we are faced with new challenges. The good news is we have some vaccines to work with, but I don't expect one to be the be all and the end all. It wouldn't shock me if one or two of them end up getting pulled for a variety of reasons, and that we may end up finding, like using 3 or 4 different vaccine manufacturers in the same shot. We do a similar thing with influenza, where we reconstitute the vaccine every year, and we put protection against 3 or 4 different strains in each vaccine. Again, this is an evolving area of knowledge, and we're just going to have to get better over time.
Dr. Fine, there's a narrative going on, starts in the White House, the new White House, that these vaccines are going to protect us, and we're all going to be vaccinated somewhere around the end of the summer, beginning of the fall. If there's no vaccine for new dominant strains, it's simply not true.
Yeah, well, I think I started talking about that a couple of weeks ago. I think this is going to be you need to get a shot 2 or 3 times a year, and we'll need to do that for the next couple of years. I think that's the evolving scientific consensus. Whether the White House is telling people that or not at the moment, I think we're going to see at least a couple of years of really, sort of impact of COVID-19 on our lives, from changes in how we deal with our social interactions to the need for vaccination. It's going to take a couple of years for us to really develop the kind of immunity, both individual and community immunity, we need in order to really put this thing make it look like a cold virus instead of make it look like a threat to human health.
In February of 2022, will we be socially distancing, wearing masks, and have much of the same controls over businesses and interactions as we do right now?
I think we will be less. I mean, I think we will have periods where we wear masks in some communities. We'll be playing, like I said, a bit of a game of whack-a-mole. Most of the time, we'll be able to have a, life like our prior life, but every once in a while, you'll see an outbreak in some places, and we may need to go to local lockdowns from time to time. Certainly business closures from time to time. If the disease spreads inside a business, we're going to have to do it case by case. This is a very fine-toothed management strategy that has to evolve over time. And what I don't yet see is the massive funding of public health that's going to be required in order to administer this correctly. Now,
Dr.
Josh,
Go ahead.
I wanted to mention that I have one great ray of hope. I was at a vaccine clinic in Central Falls on Saturday. And at that clinic, the mayor and her staff and half of the city council, when I was there, were there rolling up their sleeves, making sure people got vaccinated, helping wherever they could. It was quite an impressive community effort. And we know from Ebola that that's what it takes to really fight any viral disease. I think we're going to need to see that incredible effort in Central Falls duplicated around the state and around the nation.
Dr. Fine, 3 years from now, in 2024, if I wanted to go see Tom Brady play in the Super Bowl, right, 3 years from now, he'll still be playing, he'll still be going to the Super Bowl. Will
10
there
years.
will there be 22,000 people at that Super Bowl as there was yesterday, or will there be a packed stadium?
I think there will be a packed stadium of people who have cards that show they've been vaccinated, who are tested on the way in, and who are probably wearing masks. That's my guess.
Dr. Fine, appreciate it so much. Good news in Central Falls as the effort continues to get that community vaccinated. Unfortunately, 75,000 doses that Rhode Island has received, according to the CDC, that have not yet been administered. We'll continue to track this day in and day out. Stay tuned for more updates. And of course, as we end every show, please wear your mask. I'm just mesmerized, appalled, and horrified that every day when you go out on the street, the majority of people are now wearing masks, but there's still many, many people who are not. And that's what causes the spread of the virus and unfortunately leads to hospitalizations and unfortunately to deaths. Everybody, please stay healthy, wear your mask, keep everybody in your household and in other people's households healthy. Thank you.
Thanks, Josh.